Hello, everybody. It's Monica Heltz with your daily Fishers Health Department update. Today is Tuesday, October 13th, so we will be reviewing our community risk rating scale metrics. I will save you the suspense and just tell you that we are going to stay in yellow again. Our percent positivity rate is one of the primary metrics that we use. We do that on a 7-day rolling average, and we look at our Fishers Health Department testing site data as well as our county level data because we cannot exactly get that data for you for all of Fishers residents. So we approximate with our county data as well as our testing site data. Our Fishers Health Department testing site is at 5.33% positivity on a 7-day rolling average. Our county is at 5.7% on a 7-day rolling average, according to the State Department of Health's website. So that tells us a little bit about our community transmission. The other thing we look at is our case incidence rate on a 14-day rolling average. That is 11.78 today. So on average, we're getting 11.78 cases every day. So what that tells us is our primary metrics, our percent positivity is in our yellow zone and our case incidence rate is in our orange zone. This is exactly where we've been for the last couple weeks. Our percent positivity last week was 6.1% and our case incidence rate was 11.78. So exactly the same. Our percent positivity the week before was 5.6% and our case incidence rate was 11.71. So the same, one metric in yellow, one metric in orange. We're going to stay in yellow. And the reason we are in yellow versus orange is because of our secondary metrics and tertiary metrics that I'll now go through. Our secondary metrics are kind of to help give context and inform our primary metrics. So our secondary metrics are for our public health capacity. So we look at our testing availability, our turnaround time on our testing, and our contact tracing. Right now, testing availability remains very good at our Fishers Health Department testing site. You can get in the same day or the next day. I will mention that we are starting to see an uptick in demand for our testing. We have had an increase over the past week. This can be an early indicator that we are on the rise. So I would keep an eye open for that and be ready to maybe adjust some of your tactics or habits if you should need to. But we still do have very good testing availability. It is you should be easily able to get a test done either at our site or at any of the area sites as well, because all of the sites right now seem to have very good testing availability of less than 2 days. So that puts it in our green metric. Turnaround time on the labs remains very good. Most people are getting their lab results in less than 2 days, and that holds not just for our Fishers Health Department testing site, but also for the other testing sites when I review their data on the difference between when people are getting their results and when those tests were performed. It is definitely under 2 days on average, which again is in our green metric. Our tracing ability for contact tracing, our Fishers Health Department team is very strong on this. We are able to notify anyone who's positive from our testing site or who's reported to us from the school system and to conduct early contact tracing for those individuals the same day that is reported. And we're able to notify all those contacts as well the same day that it's reported. So definitely under 24 hours. From a state level, it is taking them a little bit longer to call down some of the contacts. So if you do get tested somewhere else, it may be a couple days before you hear from them. Feel free to get any advice you need by calling us. We're here to help. And we do want to make sure that your contacts do get appropriate notification and education on their next steps. So for the tracing measure, we have our site in green, and then statewide, I would say we were in yellow, which is no difference from the week before. The tertiary metrics that we look at are hospital capacity. So right now in Hamilton County, we're looking good. We don't have any indicators that we're stretched in Hamilton County, but primarily what we look at for our hospital data is our District 5 hospital capacity, because by and large, most of our residents would go somewhere in the District 5 network, which would include any hospitals in Marion County or any of the surrounding counties for Marion County, which includes Hamilton. So our District 5 data is only showing an increase in emergency department visits right now. We are not showing any other indicators of a strain on the hospital system in that district. I also looked at District 6, because that is the district immediately north and east of us. So that may indicate Anderson and Muncie if any of you are using hospital services there. District 5 is showing an increase in admissions, and Muncie has been on the news lately for the Ball Hospital perhaps being a little bit stretched. So keep an eye on that. Statewide, we are definitely increasing, and I will talk more about that context tomorrow. So keep keep your ears open for that video. Thanks so much for listening. Goodbye.